Hello everybody, how are you tonight? This is Dr. Sullivan back with you at 100%. I'm post-flu and I'm back with a full heart and lots of enthusiasm. We are going to be talking tonight about a really important topic called neuro-fatigue. And I'm going to teach you the differences between regular fatigue and more of a brain-based fatigue. I was motivated to do this because the last month we have spent focused on stroke. I have done 4 lectures in the last Wednesday nights. The first one we did was on cerebellar strokes. We then moved on to thalamic strokes. We then talked about basal ganglia strokes, and we ended up on the pons. So what I wanted to do as kind of a follow-up was to identify a topic that was important to all of you together as a group, as people who have survived stroke and are going on to thrive and live your very best life. So we're going to get into that in tonight's lecture. I wanted to start by just making sure that you all know who I am and why I'm here and what my motivations are. My name is Dr. Karen Sullivan, and I have the I Care for Your Brain program, which is something that I have been offering in person in retirement communities in North Carolina. But over the last few months, I've really wanted to extend my reach, and I have been doing these free Facebook lectures. And the point is to really try to connect as many of you as possible with the highest quality information that I can possibly give you, because I really feel that a layer of suffering in brain health challenges is a lack of access to experts or a lack of high enough quality information that will help you understand what's happened to you. And I just feel that it is my responsibility, really, as someone who has gone through so much training, so much education in the brain, to be able to impart that knowledge to you is truly a gift. The other thing that's very important to me and why I'm sitting here is that I really want to increase compassion in the world for people who are living with brain health challenges. So many of the times, the symptoms that you all have are things that other people can't see. And these are the things as a neuropsychologist that I spend a lot of time thinking about and caring about. So these are things like cognitive symptoms, mood symptoms. And if you can share this information with people that care about you, I really think that the experience of living post-stroke, of living with a traumatic brain injury, of living with Parkinson's, multiple sclerosis, Alzheimer's disease, all of these things could be better if people just understood better. I also want to increase self-compassion. So maybe as I'm talking tonight, it's going to help you feel less ashamed of some of these symptoms of bone-crushing fatigue, because you're going to realize it has nothing to do with being lazy. It has nothing to do with not wanting to do your rehab exercises. It is a brain-based issue for the most part, and we have to understand it so we know what to do about it. So let's just jump right into the topic, shall we? So fatigue is very common after stroke. We actually think the numbers range from about 50% all the way up to 75% following a stroke, and even up to 30% for people who have so-called mini strokes. Now, this is in contrast to the general population of people who are, never had a brain health problem. And fatigue usually comes in at about 20%. And what I need you to understand about neuro-fatigue is this is not a I feel tired, I'm going to go take a power nap and wake up feeling refreshed. We are talking about unbelievable fatigue. Like if you have unfortunately had the flu, for example, this season, you know what I'm talking about. This is I cannot get out of bed. This is can I get in the shower type fatigue. This is really, really, really intense. And what's important to recognize is it can be physical, it can be cognitive, and it can also be mental. And what we think happens in stroke is that really it's a combination of all these different subtypes of fatigue that come together to really disable the person. And I need you to know that neuro-fatigue is not unique to stroke. That's what we're talking about tonight, because this has really been the target of my last couple of weeks. But really, we could replace stroke tonight with traumatic brain injury, like I said, multiple sclerosis, things like transverse myelitis. There's a lot of different type of physical and neurological issues that cause this type of fatigue. We are going to focus on stroke tonight. So why does it matter? Why are we sitting here talking about this? Well, it matters to me for two very, very important reasons. One is it is absolutely a barrier to having the best recovery that you can possibly have. And that's really why I'm here with you, is to reduce any of the unnecessary barriers that keep you from achieving the best recovery that you possibly can. The other thing is that I really feel like it is intertwined with depression and the mindset of going against the mindset that you really need to have the best recovery. So much of stroke rehab is your mentality, what you put into it, your expectations, hopeless versus hopeful, keeping at it even when you feel like you don't want to, even if you're not seeing the big leaps and strides in your recovery that you would like to. If you can tune your thinking and your observations to a very small level, I always say this to you guys, you can see little micro victories along the way. But if your mindset is negative and you have a nothing's going to get better attitude, you will not see as many benefits. And one thing that I dramatically learned with this flu that I had recently is how unbelievably hard it is to not give in to negative thinking and depression when you feel like you have been hit by a truck. So one of my motivational messages to you tonight is, how can you keep a positive mindset when you just feel so crappy? So I always think, what would I want? I would want to know, why is this happening to me? So let's get into that. We know that there are risk factors for post-stroke fatigue. So remember, not 100% of people wind up with this extreme level of fatigue. So who are the unlucky people that wind up getting it? Well, unfortunately, what the research tells us is that people who are single, who live alone, tend to have some of the highest rates. People that had some depression before also seem to be hardest hit. That's a tough one, because sometimes we don't know if we're measuring depression post-stroke, are we really looking at something that would have been there even if there wasn't a stroke? Has it been exacerbated because of the stroke? Is the depression only there because of the stroke? It gets complicated, and this is why you need neuropsychologists to work with you to tease these things apart. But what I do think is very interesting is that it does not appear that the location or the extent of the stroke has to do with the degree of fatigue. Remember, one of the things we've been talking about are some research terms so you can become a more informed consumer of brain health news. And one of the strongest relationships that research and statistics show is something called a dose-dependent relationship. And what this means is that the more of something you're exposed to, if a certain symptom gets worse, then that makes logical sense that the two are related. So we don't see that in post-stroke fatigue. So it's not like the bigger strokes wind up fatiguing people more. So that's really interesting. The only part of the brain that has actually been shown to have more fatigue are posterior strokes. So what this means are strokes in the brainstem, and also strokes that happen on the right side of the brain. So again, remember, these are statistics, these are averages. This is not every single person with those kind of strokes, but I always want to tell you what the research says. The other thing we know is that people who have any kind of trouble sleeping after the stroke are going to be more likely to have fatigue. And sleep and fatigue, of course, are unbelievably interconnected, and we need to explain that in more detail if we're really going to help everyone understand what this is all about. So how long does this type of fatigue last? This is a very rational question. Well, it tends to start almost right away, which really suggests that there is a physiological or a biological reason that this is happening. So this is within 2 to 3 days of someone having a stroke. Typically people are starting to talk about, I feel exhausted. Then imagine you go to an inpatient rehab program, and what's great about those people is they're getting you into an intensive program, but it also requires a lot of energy. So having worked in some of those programs, I know that they try to do the most intensive therapies in the morning, and they try to let people rest in the afternoon, because if you're in an inpatient rehab, to be there, you have to be getting physical therapy, occupational therapy and speech therapy, and these are intense. They require a lot of energy. The good news is that at about 3 months post-stroke, we do see a little bit of an improvement in fatigue, but unfortunately the good news kind of stops there. I looked and looked to make sure this was an accurate statistic, and unfortunately it is, that it seems that post-stroke fatigue stays pretty stable for even up to 2 years. And some people will even tell you that it feels like it never really goes away. So that's why when we get to recommendations, it's so important that we talk about not the one secret pill, the magic weapon that you're going to pull out to get better. The truth is, I have to teach you like 10 different things that you need to do in order to get better, because there's multiple reasons that you're having the fatigue. Therefore, it's going to require multiple solutions. That makes sense, right? One of the problems, though, is that we are not talking to people with stroke nearly enough about the intensity of their fatigue. And what some scientists think is that because it's such a common symptom, you know, how many people go to the primary care doctor and say, yeah, I'm more tired than I want to be? It's almost like doctors can become desensitized to it, but we have to understand that post-stroke fatigue, we're really not talking about, again, like I said, oh, let me go take a nap. It's not the kind of fatigue that a nap actually even helps. So we have to be raising the bar on this dialogue more as doctors, that is for sure. So one of the things that I was saying before, we know happens with this type of fatigue is that it has multiple contributions. So let's go through some of the other medical things that can happen that can either make the fatigue worse. And my philosophy is like, even if it adds 1 or 2 extra layers to the problem, forget that. We got to get all these layers off, because I know from all the people that I care about with brain health issues, even if you could improve quality of life 10%, 20%, 30%, this is huge. This is so, so, so important. So I want you to listen carefully, because these are the medical issues that, if you have them, are going to be contributors to the neurofatigue. Okay, the first thing that I think about is thyroid disorders. Okay, now you might have had one before, you didn't take it that serious. Thyroid disorders typically don't happen because of stroke, but it might be something that you have co-occurring with your stroke. Okay, so you need to be on top of that with your doctor and make sure that they're taking your labs. The next one is anemia, which is not having enough red blood cells in your body that will bring the oxygen that your muscles need in order to move and to exert energy. So that's a really important one. The next one is vitamin B12 deficiency. Anyone who is a vegetarian or a vegan, I'm a vegetarian, we are at risk for this kind of thing every day. I take a little tiny vitamin B12 under the tongue supplement, and supposedly they tell me it's helpful, but when I go to get my labs, vitamin B12 seems good. You just always, that's a basic. You just want to get that done when you go to the doctor. Of course, vitamin D deficiency also can wreak havoc with your energy level. The next area is medications. There are so many medications that have a side effect of fatigue. Now, you have to work with your doctor to figure out your specific risk versus benefit ratio to see if it's worth it. But probably the biggest fatiguing medication that I can think of that you might be on now post-stroke that you weren't on before would be what we call a neuroleptic or an anti-seizure medication. Anytime there's been damage in the brain, you're at risk for seizure. Now, the problem is that seizure could further worsen your brain damage, and nobody wants that, especially you. So sometimes we have to be on these anti-seizure medications for either a period of time or sometimes a longer period of time. Most people, like 6 months, I would say. But these are heavy-duty medications, and how they work is they slow down your brain, so that way just think of it almost like, I think of it like the metaphor of a fire. Can't simmer, smolder, and get hot enough so that it kind of explodes into a seizure. So seizure medications work by really slowing down your brain. Well, you slow down someone long enough and it's going to feel like mental fatigue. And some antidepressants cause people to feel very fatigued, particularly in the first couple of weeks. We also know that different medical conditions like diabetes, untreated sleep apnea can absolutely cause fatigue. How about stress? stress, 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 right? I just did two different talks yesterday on the impact of stress on the brain. It's very, very real. The next one that we have to talk about in this conversation is depression. We know that about 30% of people who are living with the after effects of a stroke are experiencing depression. Now, what a lot of people don't talk about with depression is that it actually has cognitive symptoms. So many of us stereotype depression as a feeling issue. I feel sad. I feel like I am not interested in things. But the truth is there's physical symptoms, which can also include fatigue. There are cognitive symptoms, which is trouble making decisions, trouble concentrating. And of course, we also have mood symptoms. People can feel sadness, guilt, shame. But the problem is for this conversation is they overlap, and it's kind of a chicken or the egg phenomenon. So the way you're going to tease that apart in yourself or in a loved one, after you also consider going to see a good psychologist, is actually by asking about the content of a person's thoughts or mood. So this would be, are you feeling sad? Are you feeling hopeless? Are you feeling worthless? Are you feeling like maybe the world would be better off without you? These things really hone in on depression and kind of help you tease apart some of the other overlapping symptoms. The other thing that can make post-stroke fatigue worse, or even masquerade as it, is what we call some executive functioning problems, which is a set of cognitive issues that typically happen when someone has issues directly or indirectly with their frontal lobes. And I've used this metaphor before with you guys about the gas and the brake. You can either have too much gas where you get some impulsivity and no filter and someone kind of can't hold back, or you can get too much brake where it's like apathy. Doesn't seem like there's much interest in doing things, not nearly as much talking as before. Now that can be a tough one to tease apart with fatigue, but one way that you can do that is people with fatigue typically say that they cannot do an activity because of their fatigue. Whereas people who have apathy, it's typically like, it doesn't really even matter if I do it. So typically someone with fatigue will say, do you know how bad I would love to get out of this bed and go for a walk around the block? But my problem is that I just can't. Whereas apathy, it's like, I don't know, walking doesn't really seem to, So as we get fatigued, of course, we have an increased need for sleep. And now some people, and I actually believe this to be true, think that we actually get fatigued to put us into a state of sleep because sleep is so healing for the brain, mind, body, and soul. And I want to tell you about that. The first thing that I think of with sleep and stroke is the connection to the immune system. Now, when you've had a stroke, whether or not it's an ischemic stroke, which is a blockage, or a hemorrhagic stroke, which is a burst blood vessel, there is stuff in the brain after that from the cells that have died that shouldn't be there, that the brain does not want there. How the brain and the body get rid of it is the immune system gets all up there and starts munching away and basically helps you get rid of it and move it on out of your body, get it out of your brain. That system can work best when you are asleep because it doesn't have to be alert and fending off all the different germs in the environment. So just think of when you're sick, right? You want to go to bed. That is the overriding feeling, get me into the bed. And it's because your immune system wants to be able to focus. So in that sense, sleeping, now I don't want you sleeping all the time, but the truth is you will need more sleep for quite a while after you have a stroke. So I'm going to talk to you at the end about the importance of balancing activity and rest. The other thing is that you are more tired and need more sleep because it is taking more mental effort to do the things that you used to do. So before your stroke, your brain was very, very, very interconnected. And now you've got this focal injury. And I always want you to remember that. That is the benefit of a stroke over something that is more of a whole brain disorder, because you have one area of weakness that if you know how to, if you have the right tools, if you understand the rules of rehab, you can actually compensate for that to a nice degree. Now, will you get back complete function? It really is so individual. I can't make a general statement, but at least if you knew what to do, again, that's why we're here. that is one reason that you're tired, taking more mental effort. The other thing is when you sleep, you are processing emotionally traumatic experiences. And I am always saying this, that a stroke is a very traumatic experience. Nobody really goes through their day thinking, today's the day I'm going to have a stroke and my life is going to change. And so when we sleep, the memory part of our brain and our frontal lobes are actually like playing movies back and forth to each other all night long, and they're comparing notes and they're thinking, how does this one experience I had today make sense with the rest of my life history? And they're going to go back and forth until your brain basically decides how this new experience fits in, how it makes sense, and then it's going to store it as a memory. This is why we think people have nightmares, in part, is because it's basically a replaying on some level of your consciousness of something traumatic that happened, because your brain can't quite decide how it fits in. So I always say sleep is like free therapy. So those are 3 very important reasons. So let's move on to treatment. What actually works? How can you take this new information and put it into action? Well, the first thing I was disappointed with is that there's no evidence-based guidelines for what to do about post-stroke fatigue. And in fact, if you look at the list of things for doctors and when they're training to talk with you about when you come in 3 months, 6 months, a year later, very often fatigue is not mentioned, and that is not great because it's just so darn important. And so some research has been done to say that the most helpful thing that we can do in rehab is to give patient and family education and counseling about what to expect, how to normalize this experience of neurofatigue, and helping to give people a sense of control so they don't feel like, oh my gosh, I didn't expect this. This doesn't make sense. This totally goes in line with my philosophy about my I Care for the Brain program, which is I care enough to spend the time to explain things to you in a way that will lessen your suffering in your recovery as you go further. So that's basically, if you look at the research, it's kind of loose. There's not many guidelines. So I'm going to give you what I've hobbled together, which I think is the best attempt that I can come up with about what to do. So if you've been watching me for a while, you know that I am the biggest pushing for an assessment gal that you are going to come across. I just believe so strongly that the first step in true recovery is the best assessment that you can possibly find with all the different stroke experts. So as a neuropsychologist, the things that I cover are cognitive effects and mood effects. Doctors like physiatrists, rehab doctors, they really cover the physical effects. And so until you know your personal strengths and weaknesses, it's almost like you don't have the map. You don't really know where you are, so you don't know exactly where it is you're supposed to be going in your recovery. So this is why I chose neuropsychology, because it had the best assessment tools that I could figure out to help people with brain health challenges. So the first thing I need you to do is make a list of all the different risk factors that you personally have for post-stroke fatigue. Remember, I went over some of those a little bit ago. And I want you to work with your doctor to figure out, how can I reduce the impact of this risk factor, even if it's 5%? Because think of the cumulative benefit of going through all of those. If you come up with 4 things that are 5% contributing to your fatigue, hey, look at that. You're already way ahead of the game than you were before. So remember I said before, because this is a problem that's coming from multiple areas, you're gonna have to do multiple things. And I'm a big truth teller, right? Even when it's hard, I feel like it's my job to tell you guys the truth. The truth is, all of these things I'm about to tell you, none of them are going to work that great. That is why the 2-year post-stroke literature tells us that people are still telling us that they're very, very fatigued. So all of these things are going to help a little bit, like I keep saying, and you have to just keep at it, okay? Consistency is really the name of the game. The first thing that should really help you is low intensity exercise. I'm not even talking about personal trainers here going to the gym. I'm talking about walking. I'm talking about chair exercise. I was chatting with someone recently who had a stroke, who desperately wanted to exercise, but she had a foot injury. And that's the perfect time for just chair exercise. Even sitting in your chair, and if your two arms are working well, raising your arms up over your head every commercial break when you're watching a show. If you can only do it on one side, that's fine. Marching in place, anything that you can do that's going to get your heart working a little bit harder than it was before is going to force blood and oxygen up to your brain, which oxygen is really the fuel of all types of energy, right? So oxygen and glucose. So we have to make sure that we are getting a steady supply of those to the brain. The next one is that high quality sleep. And what you want is to be going in and out of REM and non-REM sleep all night long. A Fitbit or one of those sleep trackers, it actually is, I think, the only product that I really endorse at this point for brain recovery. Everything else that I endorse is, besides paying medical insurance, is free or low cost. And that's one of my values, is I don't think you need to be buying supplements. I don't think you need expensive brain games to get better. You just need the rules, know how to apply them to yourself. But I do think a sleep tracker, though, is worth it because it really does give you fascinating and important information about the REM and the non-REM. The next thing is something called pacing, which is really important. It's basically scheduling time in your day to have blocks where you work and blocks where you rest, blocks where you delegate to other people, and blocks where you do things yourself. You are not going to be able to work at the same pace that you did previously. And you all know this. If you try too hard, you're basically going to overdo it and you're going to pay the price later. So you really have to get into, how do I do enough to get things done in my life, to feel good about what I'm doing, but also not overdo it. So, a half hour of going out in the yard and picking up branches. Then I'm going to come in and I'm going to rest for about a half hour. Then I'm going to go maybe empty the dishwasher, and that'll take 15 minutes. And I'm going to come back and I'm going to rest for 15 minutes. You kind of have to find your own personal flow. Nutrition, what we put in our body, this is so, so important. So really, the best things are making sure you stay hydrated, avoiding as much sugar as you can, as much of the processed foods that you can, and carbohydrates. All those things have a huge sugar crash with them, and that can really exacerbate fatigue. Making sure that you are trying to live as low stress of a life as possible. This is where sharing this with friends and family can sometimes come in. Sometimes they don't realize how important keeping things comfortable is around you. We don't want people to walk around you with kid gloves and, put you in this little glass bubble, but we also want people to be sensitive and not yelling all around you and causing unnecessary drama when you just don't need it. You just can't handle it right now. This one is super interesting. There's actually a few studies that show that the lower temperature you keep in your house, the less fatigued people after stroke feel. Now that's really cool, and it actually is not the case in other types of fatigue syndromes like chronic fatigue syndrome or even depression. So that's kind of interesting. So maybe try to put the thermostat down a little bit. Music therapy, awesome, love it, so good for helping us with our mood, especially like if you're trying to walk or anything, trying to get music that really makes you happy, really makes you excited. Pet therapy is awesome. Nothing like a dog to get you out in the world. Even little tiny walks with the dog are awesome therapy. But I really wanted to spend a little time talking about stimulant medications, because this is a recommendation that I make through a primary care doctor or a neurologist that has quite a bit of success. Now you got to take this recommendation with the caveat that I'm not a physician. I am a doctor by PhD. This is not direct medical advice, okay? I'm reviewing the literature with you and giving you some of my clinical expertise, but you can't take this information and run with it. Use this as an opener to a conversation with your stroke docs, okay? So there are what we call stimulants, and basically they promote wakefulness. And one of the things that it can do is speed up the connections in all the different parts of your brain. And remember, that is essentially what a stroke is that something has gone offline that used to be very, very interconnected. And so what we can see as the benefit of these medications is it helps processing speed, and it can also help physical energy levels. Now, there are some people who don't tolerate them. So in one study I looked at, there's a drug called modafinil, and about 25% of the patients dropped out of the study because they just felt a little too racy. If you have anxiety, sometimes this isn't the best, but they also do use it actually for some people with severe depression because it can kind of, get you more activated. But it really seemed to help people who had brainstem or thalamic strokes the most, not so much in people who had cortical strokes. Okay, so that's in the gray matter on the outside, but if your stroke was more on the inside of your brain, it seems like this was a little bit more helpful. There was one study that looked at Prozac 20 milligrams, and it reportedly didn't help post-stroke fatigue, but it did help people's depression. Now, that one's kind of funky because, fatigue, it's just like chronic pain. It's like, how do you really measure that? I've talked about Prozac before. I think it has some pros that are specific to different types of people. You can go back and look at what lecture was that? Oh gosh, I'd have to remember. Maybe I'll try to post a link to it at the end of this, but I talked about how there's a lot of research to suggest that it can actually help grow new branches in brain cells, and that can be really helpful with recovery of motor function after a stroke. But really, what we want people to do is understand why all this is happening and not really feel like it's something about them. Like I said, we're all so ready to be ashamed about things. Oh God, I was lazy today, or people are ready to be like, come on, get out of bed. You had your stroke 9 months ago. Like you're using your legs fine and your words are fine. Neuro-fatigue is absolutely disabling. It is unbelievably hard to keep a positive and rehab-focused mindset when you just feel so tired. So what I'm hoping that this lecture gave you is a little bit more insight, some tools to work with, and maybe some conversation openers with family members who just maybe haven't been able to get it quite yet. So if you feel inclined to share this video, that means so much to me, the idea that this information is getting out there into the world. Now, I did want to close tonight by telling you guys that I have a pretty exciting announcement. I'm really eager to tell you that this interactive stroke recovery guide that I have been working really, really hard on is in its final stages, and we're actually starting to accept pre-orders starting right now. Now, we are literally working around the clock to get this thing done. It started off with my inspiration being the top 3 recommendations for brain rehab. And it's basically become a 65-page, as you might expect, I have no trouble going on and on, interactive guide that is going to give you the 10 rules of rehab that you have to know if you are truly going to recover from this stroke to the best of your ability. It's going to give you, I love the interactiveness of it, guides to bring to the doctor with you to respectfully request all the information that you need to know about your personal stroke. That's one thing that really gets me. You need to know where your stroke was, why it happened, what you can do to prevent another one, and all too often people aren't getting this information. We have behavior tracking guides in there that are really going to help you pay attention to the small victories, because that's your positive reinforcement for keeping going with this rehab. There's going to be a lot of great articles in there explaining things like how not to let mood symptoms get you down, how is it that sleep changes, what we can do about it. We'll revisit this neuro-fatigue, and I'm really, really, really proud of it. It should be ready. It will be ready. How about that? It will be ready by April 4th. But like I said, we're going to start pre-orders starting right now. So how you can do that is you can go to our website, which is icfyb.com, which is icareforyourbrain.com, /recovery guide, which will just be one word, and you can get more information about it there. I'm really, really, really excited to share it with you guys. It's really pretty exciting. And so because I really want to make the most of it, and it's the first thing that I'm really launching, we're also including a 15-minute support encouragement, coaching conversation with me so I can try my very best to give you the individual attention and support that I know you need out there. Let me finish by telling you about Mental Health March. This is going to be what we do all throughout March. We're going to focus on mental health, like positive coping, post-traumatic stress disorder after a medical crisis, strategies for coping with chronic pain. We're really going to try to put on our psychology hats together and learn more and try to do better. Thank you guys so much for being with me tonight, and I'm so eager to see what you all think about the stroke guide. Really excited to get that out there. Thank you guys so much and have a great night. Bye-bye.